I'm Dr. John Minichetti. I'm one of the co-directors of the AAID annual conference scheduled for Phoenix. It's going to be on November 12th through 15th, 2025. Very excited about our AID meeting. Dr. Matt Young is our president this year. And we have a lineup of star-studded speakers and lectures. And Dr. Shankar Iyer, world-renowned lecturer, clinician, and leader in the field of implant dentistry. Thank you so much for doing a quick interview.
Thank you, Dr. Minichetti, for inviting me for this promo video, and thanks, Matt, for organizing this. It's such a pleasure to be on the podium, discuss some of the common controversial topics, and I'm also honored to have two workshops that will be presented during the course of the meeting.
Beautiful. So what's the title of your lecture? I think it's Counter Arguments in Implant Dentistry. What
Correct.
an interesting topic. Tell me what that's about.
Well, we've had a lot of controversial debates whether we should use zygomas or should we go with sinus lifts. Should I use short implants or should I go into extramaxillary anchorage? Should I splint or should I leave it freestanding? Are four implants inferior to six implants or eight implants? Or should we do canine guidance or should we do balanced occlusion? There's also different types of grafting controversies, whether we should do autogenous versus allografts, or should we do bovine versus alloplast. So as you can see, there are a lot of extreme viewpoints, and we should be looking at science and what evidence exists. So this presentation is going to explore topics like socket shields, what's the evidence on that? Should I really have a buccal plate built? Should we do site development? What is the influence of fat implants versus narrow implants? Is there a need for molar implants versus mini implants? So you can see that there are diametrically opposite views in implant dentistry, and often it's the clinician's choice, and they are lured by corporate influence without scientific basis. Something new comes out in the market, and you just go out and buy. And after, you know how long you've been practicing implants, and you do have a formula that works. Maybe we should stick to something that's proven and tried, or should we subject our patients to experimental procedures that do not have long-standing evidence? So this would be another topic that we would be discussing. Maybe we should stick to titanium versus zirconia. What's the evidence to use zirconia implants? Is it more biocompatible than regular titanium implants? Are alloys inferior to commercially pure titanium? So a lot of biomaterial controversies that are there in implant dentistry. Should we do internal connection versus external connection? Is there a merit to doing deep conical connection versus internal hex? What evidence there is regarding the different types of connections? Many companies are going towards platform switching. Is platform matching inferior to platform switching? Do we
Yes.
need threads going all the way to the top, or do we need any sort of a surface, characteristics on the platforms? What's the evidence for polish collars versus, something that has a laser lock or some kind of a comparable threads or micro threads on the crest? So we don't really think about all these. We just go by certain concepts, and unfortunately, implant dentistry is surrounded by concepts, not on evidence base, and it's also podium driven and eloquence based rather than evidence based. So as you could see, I thought this might be a good list of topics that we can explore from a scientific basis, from an evidence based perspective, to help the clinician decide in certain clinical scenarios what would be better in choosing one modality over the other.
Yeah, that sounds like a big topic. There's a
It
lot
is a
to
big topic.
cover in a main
Right.
podium presentation. So you got your work cut out for you for sure. And you're right. I think what the profession needs is more evidence-based uh,
Choices.
evidence, or follow-up versus, what's a fad or what everybody's doing at this time. It seems like we all do get on the bandwagon, like what's popular this year or this decade.
Right.
Yeah.
True. And you've seen it all, being in practice for over 4 decades and seeing the rise and fall of different systems. So it might be good for the younger generation to see where we were and what's happening now and what's in store for the future.
Absolutely. I think it's a great topic. Well, thank you so much. You got your work cut out for you putting that together, that presentation. And
So
now you are doing a couple of workshops too. Why don't you just give us a little
yeah, yeah.
background?
I know. I mean, sinus graft, in my opinion, is still the gold standard for managing posterior maxillary atrophy. So we should be looking at that concept or that modality for managing combination syndromes. Many a times, patients don't have any other option when there's a flabbage in the premaxilla, there is pneumatized sinuses, and often we wonder, should I go for zygomas? Or should I do alveoloplasty? Should I do reduction of the ridges? Should I go for pterygoids? Or
Right.
there are simpler, more practical approaches like doing a bilateral lift and doing an anterior cantilever, as opposed to having any sort of extra maxillary anchorage. I'm not saying that shouldn't be used, but I think for general practitioners who are probably not looking to do extra maxillary anchorage, this might be a very predictable option to choose from. And I think that would be a good topic to have this discussed at a workshop level, so they'll get to do lateral lifts and also do some ridge expansion.
Very, very good. Yeah, the other topic I think you're doing is gingival grafting, correct?
That's a topic which I think is an offshoot for enhancing aesthetics. When do you do a free gingival graft? When do you do a connective tissue grafts? And this is going to be on pig jaws. So we're hoping that we will get some good participation for practitioners who are looking to enhance the aesthetics and also to increase the zone of keratinized tissue to be able to see the outcomes. And Dr. Hegde and I, we are doing this together. She's board certified periodontist and board certified
Sure.
implant dentistry. So we're looking forward to having her do some of these aspects of soft tissue enhancement. I'll be talking about abutment selections and aesthetic contouring of soft tissue. So I think it's going to be an interesting session to be going over all of the soft tissue aspects.
What a great clinician to work with and a lovely individual, great teacher. So,
Absolutely.
what other reason should people check out our AAID meeting besides the education?
Listen, I'm bringing in all of my residents from Rutgers. They've been to other specialty organizations. They all are looking to come to AAID because this is where the excitement really happens. We are practical clinicians. While there are esoteric topics that we need to address, the residents want to know what they can go back and start to do. What are the clinical pearls that they can currently learn as opposed to being stuck with some research that they will never get to finish or some topic which is still not come to fruition. So if the residents want to do something right away, something that's practical, the AID is the place that they should be coming in large numbers to see what clinicians are doing. AID is known for cutting edge innovations, and what a better place for all of our postgraduate residents to come. And even for clinicians, you can see the peers, it's no longer intimidating. You're not looking at somebody who is going to tell you, this is all that I can do, leave the cases to me. They are actually going to tell you, here's what you can do. This is what's going to happen if you do it this particular way. And we are, down to earth clinicians who want other clinicians to succeed and have a great outcome for their patients.
Awesome. Absolutely. It's a great place for camaraderie, learning on the main podium, learning in the workshops, learning in the hallway.
I'm so excited, not only from a presentation perspective, just to be able to meet up with all the old friends. And, AID is about human relationships. We actually long for this annual meet to be able to bond. We may not see our colleagues for a whole year, but then when we get there, 4 days just flies by. And
Sure,
it's
yeah.
amazing how every evening is so fun
Yeah.
filled. Everybody's smiling. Everybody wants to cherish others' success. And this is where we build relationships.
And we recognize those who have achieved great success,
Yeah.
our fellows, our associate fellows, our diplomats. So, Dr. Iron, at this meeting, you're going to be receiving the Gershkoff Goldberg Award, one of our prestigious awards. What an honor for you, Dr. Iwer.
Well, I'm overwhelmed. It has still not struck me, thanks to the past presidents, including yourself. I don't know how it all came about, but I'm just waiting to absorb, and I'm sure it's going to be a tearjerker when I get there. What greater honor! I'm so thrilled to be a recipient, and I can't wait to share the success with all of our colleagues. It's a true representation of the hard work of all of our presidents that went in, so I cannot singly take credit for it. It's a combination, it's a combined effort of all the successes that we have built over the years.
Absolutely. I'm sure I speak on behalf of the Academy and past presidents that you are so deserving of this prestigious award for sure.
Thank you, John.
For
Thank you very
sure.
much. Looking forward. I can't be more
Yeah.
excited.
So it's going to be an exciting meeting, November 12th through 15th, 2025, Phoenix, Arizona. The weather's going to be perfect. We're going to honor our president, Dr. Matt Young, and Dr. Ira Goldberg on his award, and many, many, many more. So I think you guys should check it out. Go to AID.com and register today, right?
Absolutely. And then don't miss out on these specials of the hotel. We want that hotel. I mean, it's if you go on site, it's twice. So I urge everybody to fill in their request for the hotel rooms. It'll be sold out very quickly.
Yep, register early. Thanks
Reg-
so much, Dr. Ira. It's going to be a great meeting.
Thank you very much. Thank you so much. Can't be more excited. Take
Okay,
care. Bye
thanks.
bye.